Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. So you can also visit my playlist. In the playlist I have provided almost all the topics in a very systematic order. So you can make use of it also for the continuous study. Now, 2 or 3 classes we have taken regarding vaccination, and today we will continue some more concepts related to vaccination, especially practically. We will discuss some of the case scenarios. So I hope 2 cases we have already described, and today we will have another important case, case number 3. Now actually what is this case is, Ramya, she is a female child. She received Pentavac from the local hospital. Pentavac, that is the primary doses. So she received from the local hospital. And now she has been brought to primary health center for IPV. Okay, so almost 2 or 3 days back, the Ramya has received Pentavac from the local hospital. Maybe first dose, maybe second dose, maybe third dose, whatever. In between, she didn't have OPV, that means she has not received the IPV, because the problem actually previously few months back, ki local hospitals will have the Pentavac vaccination they can give, but IPV supply will not be there. Okay, intravenous polio vaccination, IPV supply was not there in the local hospitals. So if you want to have the IPV, you have to go for the government hospitals. Okay, so in between we didn't have IPV in the private sectors. So patient has to take the Pentavac in the private sector, and just for IPV he has to go for the government sector. Okay, now the situation has been little changed, but previously this is the issue. Now the question is, 2 to 3 days back she has taken Pentavac, and now already 3 days are over. She has not taken IPV. Now, giving IPV after 2 or 3 days so late, is it scientific, or whether any problem like vaccination failure, etc.? I hope you understand the case. Okay, so usually with the DPT we will also have IPV doses. Okay, now in this case local hospital didn't have IPV with them, but Pentavac they had, so they have given. Now for the IPV she has to go for the government hospital by the time 2 or 3 days are over. Okay, so now is it okay, is it scientific, or whether there is any problem? This is the question. Now, what is the analysis? See, when we give the killed vaccine in intramuscular route, it will only go to the regional lymph nodes and not in the generalized way throughout the body. So this is a basic difference between the live vaccine and as well as killed vaccine. When you administer any killed vaccine, suppose it may be in the gluteal, or it may be in the deltoid, or it may be in the lateral aspect of the thigh. So when you give that vaccine, actually when you give the killed vaccine, it will not go all over the body. So effect of that particular vaccine will be restricted to the regional lymph nodes. That means first that vaccine will be uptaken by the regional lymph nodes, and there the proliferation start, T cells and all those things, immunity process will going to start, and it is not generalized. Okay, now if you give another killed vaccine after 2 days, just like in this case IPV, at a different site, then it will go to the another different regional lymph node. Suppose in the first time you have given to the lateral aspect of the thigh, now I am given to the deltoid. So now the vaccine uptake of both the vaccines will be different. One is in the regional lymph nodes related to the thigh area, another is regional lymph nodes related to the shoulder area. Okay, so killed antigen are substantial and they will not multiply in the body, so there is no risk of suppression of its multiplication. So this point we have to understand. So although you are giving in 1 or 2 days of gap, as both the vaccines are killed. Now if you talk about Pentavac, the Pentavac is also contained the killed vaccine actually. Okay, so it's actually Pentavac toxides we are giving, pertussis toxide, diphtheria toxides, okay, and tetanus toxides we are giving. They are not the live virus or half killed virus. So there are the tox sites. So this can be also just like a killed vaccine only. And IPV is anyway killed vaccine. Okay, so both are killed vaccines. So if you are using both the killed vaccine, okay, the same day you are not giving, in a different day, maybe even after 1 week you are giving, actually they will not interfere with each other as both the vaccines are killed vaccines. Okay, therefore a killed vaccine can be given at any time after or before. In this case, IPV is a killed vaccine, so it can be given and it is scientific. It will not interfere with the immunological aspects. With the immunity it will not interfere. So usually such things will happen in the clinical practice. Sometimes we don't have particular vaccine, and 1 week's vaccine we are giving today, and we'll call the patient mother after 3 or 4 days when this vaccine is made available to us. But only thing is, if it is a viral, that means a half killed vaccine, okay, or live vaccine, then you have to maintain a gap of at least 4 weeks before 2 vaccines. Okay, if it is a killed vaccine, there is no such rule, but one thing you have to ensure that both the time the vaccine will be given at different site. Okay, first vaccine you have to given to the lateral aspect of the thigh. Ensure that the second vaccine which are going to give after 2 days or 3 days, it should be given at other site like deltoid or gluteal, so that there will not be any interference with the local lymph nodes also. So this is a very important aspect, one of the most commonly faced problem in the clinical setup. So thing is, killed vaccines are safe. They can be given, even they can be given on the same day also. If you want, they can be given on the same day. Usually we will give, but it should be on different sites. But whereas live vaccine, when you are talking, you cannot take this particular risk. So this is about this important case. Thank you very much. With another case, we will meet on the next day. Thank you very much.